Assalamu alaikum. Welcome to our channel Botany with YouTube. Today I'm here, a PhD scholar. I'm going to present a topic, cancer. It is a most interesting and informative topic. Contents of our video will be analog, how cancer start, gene changes within cells means mutation, how mutation happen, how cancer grow, how cancer get bigger, how cancer can spread, where it can spread, stages of cancer, TNM staging system, number staging system, types, cancer development and cell division, body system and cancer, causes of cancer, is it genetics, symptoms of cancer, prevention of cancer, treatment of cancer, WHO response of cancer. Analog. Cancer is the uncontrolled growth of abnormal cells anywhere in the body. Cancer is a group of disease involving abnormal cell growth with the potential to invade or spread to other part of the body. If you are new in our channel, then please try to subscribe our channel. You can see here the logo of Botany channel. How cancer start? Cell changes occur and cancer will be start. All cancer begin in cells. Our bodies are made up of more than 100 million cells. Cancer start within change in one cell or in small group of cells. Usually we have just the right number of each type of cell. When the uncontrolled growth of cell or growth of tissues will be formed, or lump of tissue will be formed, or abnormal growth, abnormal outgrowth will be formed at any area, it will called tumor, it will called cancer. A primary tumor is where the cancer start. Some types of cancer are the starting point. They start from blood cells. They start from any type of skin tissues. Gene changes within cells. For example, mutation. Sudden mutation in the body, in the cells, also cause cancer. Genes make sure that cells grow and make copies in a orderly and controlled way and are needed to keep the body healthy. Sometimes a change happens in the genes when a cell divides. This is a mutation. This condition will be called mutation. A sudden change or sudden happening or sudden changing in the situation or sudden changing in the structure of genes, in the structure of sequence of genes in the cell, then this process will be called mutation. And due to mutation, cancer will be spread. Due to the mutation, a cell start making too many proteins that trigger a cell to divide. A cell stop making protein that normally tell a cell to stop dividing. Abnormal proteins may be produced that work differently to normal. How mutation happen? Mutation can happen by chance when a cell is dividing. They can also be caused by the process of life inside the cell or by things coming from outside the body, such as the chemicals in tobacco smoke. Some people can inherit faults in particular genes that make them more likely to develop a cancer. You can see here in diagram, mutation occur in the genes. How cancer grow? Some cancer are benign and some are malignant tumors or malignant cancers. Benign cancer or tumor is starting point, usually grow quite slowly, do not spread to other part of the body, usually have covering made up of normal cell. Benign tumor are made up of cells that are quite similar to the normal cell. They only cause a problem if they grow very large and become uncomfortable or painful, and when they will be visible or unpleasant to look at. Malignant tumor are made up of cancer cells. They usually grow faster than benign tumor, spread into surrounding tissues and cause damage. And it is the highly risky and dangerous type of tumor or cancer. It have ability to spread to other part of the body in the bloodstream or through the lymph system to form secondary tumors. This is called metastasis. You can see here in diagram benign tumor cells and malignant tumors. How cancers get bigger? The cancer cells grow and divide to create more cells and will eventually form a tumor. A tumor may contain millions of cancer cells. All body tissues have a layer that keep the cells of dead tissue inside. This is the basement membrane. Cancer cells can break through this membrane. The cancer is called invasive cancer if it breaks through this membrane and spread to other part of the body. How cancer can spread? Primary and secondary cancer. The place where a cancer starts in the body is called primary cancer or primary site. Cell from the primary site may break away and spread to other part of the body. These cells can then grow and form other tumors. These are called secondary cancers or metastases. How cancer can spread to other areas of body? Cancer cells can spread to other part of the body through the bloodstream or lymphatic system. There they can start to grow into new tumor. For example, there are some type of cancers. For example, bowel cancer, breast cancer, bloodstream cancer, blood cancer, liver cancer. In order to separate some cells from the primary cancer must break away and travel to another part of the body and start growing there. Cancer cells do not stick together as well as normal cells do. They may also produce substance that stimulate them to move. You can see here in diagram. Some cells can break away and go into small lymph vessels or blood vessels called capillaries nearby. Where can cancer spread to? You can see here in diagram in brain, lungs, bones, lymph nodes, liver. Cells can break away from a cancer and spread in the blood or lymphatic system to almost anywhere in the body, but most type of cancer tend to spread to one or two places in the body. Stages of cancer. What cancer staging? Staging is a way of describing the size of cancer and how far it has grown. When doctor first diagnose a cancer, they carry out tests to check how big the cancer is, where it has spread into surrounding tissues or not, whether it has spread to other part of the body. Staging is important because it helps your treatment team to know which treatment you should have needed. Doctors may recommend a local treatment such as surgery, radiotherapy. If your cancer is just in one place, this could be enough to get rid of cancer completely. Botany with YouTube is our channel. Share our channel with your friends, with your colleagues and with your researcher. All the data of your syllabus, all the data of your course outline related to your subject botany is present here. The TNM staging system, it stands for tumor node metastasis. T describe the size of tumor and describe whether there are any cancer cell in the lymph node. M describe whether the cancer has spread to different part of the body. This system uses letter and numbers to describe the cancer. T refer to the size of cancer and how far it has spread into nearby tissues. It can be 1, 2, 3 or 4. with one being small and four large. And refer whether the cancer has spread to lymph node. It can be between 0 to 3. M refer whether the cancer has spread to another part of the body. It can either be 0 or 1. 0 will represent if the cancer has not spread, and 1 should represent if the cancer has spread. So for example, a small cancer that has spread to the lymph node but do not anywhere else in the body may be T2N1M0, or a more advanced cancer that has spread may be T4N3M1. It is the most interesting and most informating, most usable technique to diagnose the blood cancer or any cancer in the body. Number staging technique. Stage 1 usually means that a cancer is small and contained within the organ it is started in. Stage 2 usually means the tumor is larger than the stage 1. Stage 3 usually means the cancer is larger. Stage 4 means the cancer has spread from where it started to another part of the body or organ, for example, liver or lungs. This is also called secondary or metastatic cancer. Sometimes doctors use the letter A, B, C to further divide the number of categories. For example, stage 3B types. The most common types of cancer is breast cancer, lungs cancer, prostate cancer, skin cancer. Each year, more than 40,000 people in the country receive a diagnosis of one of the following type of cancer: bladder, colon or rectal cancer, kidney cancer, liver cancer, pancreatic cancer, thyroid cancer. Other forms are less common. According to the National Cancer Institute, there are over 100 types of cancer. You can see here in diagram: thyroid cancer, breast cancer, liver, gallbladder, upper stomach, pancreas, colon and rectum, uterus, kidney, ovaries. Cancer development and cell division. Doctors classify cancer by its location in the body, the tissues that it forms in. For example, sarcomas develop in bones or soft tissues while called sarcoma cancer. When cancerous cells spread to other part of the body, the medical term for this is called metastasis. A person can also have more than one type of cancer at a time. Body symptoms will be show when the cancer will be in its peak form. Some cancer may block channel in the body and stop particular system of the body. Some cancer may cause changes in the body by pressing or surrounding body tissue or organ. The blood and circulatory system and how cancer affect it. Some cancer and cancer treatment can change the number of blood cells circulating in the blood. You can see here blood without oxygen and blood with oxygen in diagram. Cancer can be spread by shedding cell into the bloodstream. That may then settle in another part of the body. The lymphatic system and how cancer affect it, you can see here in diagram. Normally, this system help to trap and destroy cancer cell as well as bacteria and other harmful organisms. Sometimes cancer cell get trapped in lymph node close to the cancer and may then start to grow there. The immune system and how cancer affect it. The immune system protects the body against illness and infection. Cancer and its treatment can sometimes weaken the immune system, but some treatments can boost the immune system to fight against cancer cells. The hormone system and how cancer affects it. The hormone system is a network of glands and organs in the body that produce hormones. Cancer and its treatment can sometimes change hormone level and cause side effects. But some treatments can help to control cancer or prevent its coming back, changing particular hormone level. You can see here in diagram thyroid glands. Causes. There are many causes of cancer. Some are preventable. For example, 480,000 people die each year from smoking cigarettes according to data reported in 2014. In addition to smoking, risk factor for cancer includes heavy alcohol consumption, excess body weight, physical inactivity, poor nutrition. Is cancer genetic or not? Genetic factors can contribute to the development of cancer. A person's genetic code tells their cell when to divide and expire. Changes in the genes can lead to faulty instruction and cancer can be formed. Some genes change protein that would usually repair damaged cell. This can lead to cancer. Other changes that can result in cancer take place the chemical signals that determine how the body will be express your genetic features. Finally, a person can inherit a cancer type. A doctor may refer to this a heavy hereditary cancer syndrome, inherited genetic mutation. significantly contribute to the development of 5 to 10% of cancer cases. Means only 5 to 10% are genetically inherited cancer cases. Botany with YouTube is our channel. Like our channel. If you have any question, you can ask us in comment section. You can share your point of view. You can share your knowledge related to topic of cancer, related to topic of tumor. It's the most interested and valuable, interesting topic. You should have to participate through the comment section. You can share your point of view. Symptoms. Sign and symptoms caused by cancer will vary depending on the what part of body is affected. Some general sign and symptom associated with but not specific to cancer includes fatigue or weight changes, suddenly loss or gain of weight, skin changes, yellowing of skin, darkening of skin, redness of skin, changes in bowel and bladder habits, cough and trouble breathing, difficulty in swallowing, feeling discomfort after eating, unexplained muscle and joint pain, unexplained fever and night sweating, unexplained bleeding. Prevention. Cancer risk can be reduced by not using tobacco, avoid the smoking, maintaining a healthy body weight, eating a healthy diet includes fruits and vegetables, doing physical activities on regular basis, avoid harmful use of alcohol, get vaccinated against APV, hepatitis B, avoiding ultraviolet radiations, ensuring safe and appropriate use of radiation in the healthcare, reducing exposure to outdoor air pollution and indoor air pollution, early diagnosis of cancer. When identified early, cancer is more likely to respond the treatment and can result in a greater probability of survival and you can read this paragraph. Treatments. Innovative research has fueled the development of new medication and treatment technologies for cancer. Doctors usually prescribe treatment based on the type of cancer, its stage at diagnosis, and the person overall health. Chemotherapy is a treatment aimed to kill cancerous cell with medication that target rapidly dividing cell. Hormone therapy involves taking medication that change how certain hormones work or interfere with the body ability to produce them. For example, hormone therapy is used for breast cancer. Immunotherapy, it will be uses for the medication and other treatment to boost the immune system and encourage the immune system to fight cancerous cell. Personalized medicines, it is a new developing approach. It involves using genetic testing to determine the best treatment for a person, particularly presentation of cancer. Radiation therapy, this is a therapy uses high dose radiation to kill cancerous cell. Stem cells, in this transplant can be especially beneficial for people with blood related cancer. Surgery, it is often a part of treatment plan when a person has a cancerous tumor. In this, surgeon may remove lymph nodes to reduce the disease. WHO response, WHO and IARC collaborate with the UN organization and partners to increase the political commitments for cancer prevention and control, coordinate and conduct research on the causes of human cancer and the mechanism of cancer reduction techniques. It helps to monitor the cancer burden. It is used to identify you can see here the patient read this paragraph. WHO response set the agenda for cancer prevention and control in the 2020 WHO report on cancer. Cancer prevention and treatment services should be accessible and affordable for everyone. 3.7 million lives can be saved. 9.6 million people die from cancer each year. One third of the most common cancer are preventable through early detection and timely treatment. Thanks for your concentration. Thanks for your attention. Thanks to visit our channel. Hope you will be fine and shine. Good luck to all of you. Allah Hafiz.